In medtech, the difference between a good quarter and a great one isn't always the product. It's the friction standing in the way. Broken sales cycles, misaligned teams, deals that stall at the finish line. Every leader feels it, and the best ones know how to remove it. Welcome to Zero Friction, the podcast where we go inside the minds of medtech's top commercial leaders to uncover the real barriers they face, the decisions they make, and the systems they build to keep the revenue moving. I'm your host, Terry Kuchaluchis. Let's remove some friction. Well, folks, welcome to the Zero Friction podcast. And I have a really exciting opportunity today for all of us. John Nycz, who is the co-founder and CEO of Rapha Digital Health, is with us today. John has spent sort of a couple different careers. He's been in the operations business, Lean Six Sigma. He's probably spent the last 10 to 12 years in healthcare as an operator, and he's now just co-founded this new Rapha Digital Health platform. And we're here to get a better understanding of John's history and his purpose, but also more importantly, understanding what Rapha can do for healthcare purposes moving forward. So John, great to have you. Appreciate you being here. Why don't you give us a little background on yourself and Rapha as well?
Terry, thanks for the opportunity. I actually got started on this journey in 1995, oddly enough, with a 100-mile-an-hour combined impact head-on collision. I suffered what was described as the same injury that would be received if you jumped out of a 7-story window. And the bone wasn't healing. The surgeon suggested we fuse the joint, which would have obviously had significant impact on how I conducted the rest of my life. So I did some research, found some information on early bone stem devices, found an acupuncturist that wired me up. And then over the course of 6 weeks, I went back 3 times a week. Long story short, hard bone growth. I've had no limitations except I can't run long distances. An amazing recovery. And the way we tie that back together is in 2015, I was approached by another company about this, and I learned some valuable lessons about how important it is to have the economics in place so that the research can get done, even for therapeutics that were viciously effective. A lot of these devices add huge value in things like diabetes and treating non-healing wounds, neuropathy. It's pretty significant. So the way that transitions, Terry, is we started looking at this problem through the lens of my prior experience with operational excellence, Lean Six Sigma leaders. I got to hang around with a lot of people who did some very interesting things with analytics. Going to their presentations, I would pick up how these connected into the business. And so when we started looking at the problem we're looking at now, there was a big gap with the data. And what we saw was we were looking at it through the lens of treating fibromyalgia. We were asked to be involved with a project. And so it was pretty narrowly scoped out already. The lessons I walked away from with those experts on those subjects was make sure you keep this thing scoped enough. Well, the problems with healthcare information are too huge to begin. So that's the correlation to take this thread from my sweater and walk away. We found a thread. We found something we could start pulling on in a corner that is vastly in need of improvement. And then those improvements we can propagate across other complex chronic conditions.
So what's sort of like the main driver behind Rapha today? So we have fibromyalgia, number one, which is, a chronic disease. 2, Rapha, is it a health platform? Like what is the foundation and the backbone behind what Rapha's purpose and intent is?
Good place to start. It's really an ecosystem. We support clinicians by getting them better information in a more timely manner. And we'll get to what we do with collecting that information. But an electronic health record these days has a lot of things in it that don't necessarily add value for the guy or gal that's trying to, what's wrong with this patient? So they got to sort through ICD-10 codes, information about reimbursement optimization, all kinds of other information are floating around in these documents. It makes it easy to streamline that and pull forward what's relevant just for those clinicians. But in this particular case, there's also some big gaps regarding education and content. They're simply not trained on other alternatives, and the data set's not looking for that. So
Let's talk about like fibromyalgia. Go ahead.
I was just going to say the ecosystem ultimately allows us to provide care for patients. So the platform that we have built does a couple of things, take advantage of the fact that telehealth for this population is such a better option because you can frequently see that patient. The 90-day path that they traveled with us is much different than the 5 to 7 years it can take for a diagnosis for these patients. And they're spending a lot of money along the way. So again, the decade that I spent with those operational excellence executives, the people driving process improvement in the world's largest organizations, was invaluable because we looked at this and there's gaps all over. There's a lot of things that we can close with tools like lean and process control, making sure that we're compliant and making sure that we can more effectively manage the business. A well-run telehealth organization can operate 20 to 30% less than a clinic, and 30% of these patients are missing their clinic appointments. So that's friction.
So that's friction and definitely inertia too. So, let's talk about the pain points for the patient that does have fibromyalgia as well. So, I know that they have their own sense of friction in their world, and it's hard to diagnose, it's harder to treat, it's hard to identify what treatments work with what type of patient. And it sounds like having a digital health platform that is foundationally an ecosystem for these patients is a great start.
It really does tie together what we'll circle back to with the data moat. The noble purpose of what we're doing is really about getting this data set together that we know has been subject to by exclusion bias. It's simple. The chief commercial officer at a pharmaceutical company doesn't necessarily, a lot of the things that might have impact, will have impact, aren't relevant to what they're trying to accomplish, just being candid. But there's tons of activity that's not being tracked. And when we compile this information, we can see the correlations, we can monitor frequencies, we can see, is Lyme disease relevant as a trigger? Is stress relevant as a trigger? We get more and more information around that, but we also are able to see are our efforts to manage gut health valid with a larger portion of the population. And it will be no simple answer. Oh, we discovered that if you pull your earlobe twice, it's not that. That's where personalized, or rather healthcare comes into focus. So we can use that information to drive a lot of valuable informatics for the clinician. That's really the neat. That's what gets me out of bed every morning, is knowing we're actually fixing a problem. And if you talk to these people who've done the primary research and had some meaningful conversations with family members and patients that wrestle with this, it can wreck your life. It's significant. And a lot of comorbidities get dragged along in the way.
The one stat I think you and I talked about earlier, that 8 out of 10 patients that have fibromyalgia are female, right? And that has a major dramatic impact on personal, professional, work life balance. I mean,
And families, and
families.
predominantly mom's role is a big one, and it's multifaceted. Typically, they will often go 3 days without sleep. Think of the ramifications from that, knowing just what the health impact of that is.
Right.
But fibro fog, you mentioned pain points, and I know you were talking about kind of pain points as far as managing what's going on with all this, but I think there's 18 of them that they used to track, where they would have pain that during a flare up, it might manifest itself in one place or another, very much like rheumatoid arthritis, but absolutely devastating, impacts their ability to work, their absenteeism, presenteeism, affects their husbands, their kids. It can be really bad.
Sure. Just think if you're a single mother and dealing with something like that as well, that must be really a dramatic impact when you're the only caregiver in a lot of ways. So, huge problem, a lot of pain that goes with it, just in terms of dealing with the pain itself, and trying to figure out how to fix it, right? That's the other thing that you and I talk about, is that there's really no way to quickly diagnose.
It's a great point. It's a diagnosis by exclusion. So that another challenge that we face with today's healthcare paradigm is you simply don't. I can't get an appointment. It's 4 months. It's 60 day, 180 days. They can be a long way out. So given the fact that it's a diagnosis of exclusion, it takes patients a long time to hit the frequency they need to gather all the information to say, well, it's none of these things, therefore it's this. And we can, in the telehealth world, not exclusive to what we're doing with our ecosystem, we have a lot of other benefits we'll discuss, but just in the telehealth paradigm, that frequency can be easily managed in days, a couple weeks here, a couple weeks there. I mean, most appointments for most patients will be in the next day or two, and we'll feel bad about two.
Right. So when you talk about that ecosystem, right? So what's underneath that ecosystem? So we talked about telehealth number one. What other parts of, is there communities, or is it a patient based community? Is it a clinician based community, or is it all of the above? So kind of describe to us what that infrastructure looks like.
Great question. Some of it will be driven by the way we develop content. A lot of that content is used for marketing purposes, but we'll have content targeted to both the patients and some of the other people influenced and in the universe of the patient, and to the clinician. Obviously, the clinical content will be retrospective case studies, things like that, and some things that we can get our teeth behind. And then the content that we build for the patient will be shared in that community with the patients and selectively outside that community. But it will include everything we need to do with EEAT to make sure it's valid for AI. They expect it in 2 years to be about half the people that were going to the internet for healthcare searches would be using that platform. I would not be surprised if we're already there. And this prediction was made 9 months ago. So it's very quickly moving that direction. And the content that we're developing will support that. It will also be much wider and broader than what happens in real life with the patient's journey when they finally get to the end of this rainbow and they've received a fibromyalgia diagnosis because everything else has been ruled out over 5 to 7 years, as they've spent $5,000 a year out of pocket or more. The big win is, okay, now we can cover, some of your insurance claims for fibromyalgia, but most of the treatment alternatives that will be put forward in traditional healthcare are going to involve pharmaceuticals. And it's not the only answer. So our mission is to, widen that data set at the same time as we make sure that it's all valid and relevant. And that's
Is there
another
anything that
part too.
Is there anything that we can, like not just treating fibromyalgia, but is there anything out there in the horizon around actually diagnosing it so that you can, again, get back into the sort of mindset of precision medicine versus, you said that you're basically you're just figuring out what's not working, and it's sort of becomes the result of subtraction versus actually aiming at something.
I don't think so.
Okay.
Here's the upside, though. If I had to guess, and again, I should set the stage correctly, I am not a clinician, but I've done a lot of homework. And I think what we're going to find instead, that rather than having this is the definitive root cause of this condition because there could well be multiple, we will find that there's going to be things that make a big difference. Low inflammation, managing your inflammation, managing your gut health. And these things won't be, hey, fix fibromyalgia. These things, when we get done collecting enough data and tearing it apart, will be, oh my God, that fixes chronic fatigue too. Oh, that's a big help with Lyme disease. Got to start there. Brain and the gut are connected, and it's really interesting, but some of that stuff got skipped along the way. And if we collect enough data in enough spaces, we can make sure, as long as we can ensure that data is correctly corrected and managed correctly. So that's why we stack the deck with a lot of these people that have been running operational excellence and really understand Lean, Six Sigma, process control, analytics, and continuous process improvement. So we actually use AI to improve the processes continually, which is
Got it.
interesting.
So how big is the problem? Like how many people are being treated for fibromyalgia today? Like how big is that problem in America?
It's pretty significant. 4 million patients diagnosed, another 6 million looking for answers, and the
Okay.
potential for another 4 million above that that are trying to find, do I have chronic fatigue, or do I have Epstein-Barr, or do I have fibromyalgia?
Okay.
But 10 million is the estimated number of
Huh.
people that are wrestling with these symptoms.
So basically, almost 2% of our population or thereabouts, right, are wrestling with those types of symptoms.
Yeah, what was it? 2.9, I thought, something like that. Yeah,
Wow.
it's a pretty significant number. And again, not everybody is in, they're all, they may have different levels that they're impacted at or are managing it more effectively. Another part of this population is 6 million people that may have fibromyalgia that have not received a diagnosis yet is a cadre of folks that, I'm handling it on my own. I did my own research. I know what's working. So you mentioned the communities.
Right.
And yes, we absolutely are building communities for both, and we want to have the best content and quality of information that's available in those communities. There's a lot of great communities and interaction that goes on in some of the public domains, and there's some shady stuff too. There's some platforms that we've looked into that don't really have any structure behind it. Some of them are leading some great research, but in any social platform, it's a little bit of a free for all, and you really do not know what is clinically relevant, what has been correctly measured, what is making a difference, and what isn't. And that's primary among our missions is being able to go, oh, here it is. Here's the data.
Right. And here's a community, and here's a clinician in this market, and I think when you think about the opportunity that Rapha Digital Health has, it's not just collecting information, but it's disseminating, it's using information so people have access to it as well. What are typically people like who are treating themselves? What are they treating themselves with? Is it diet? Is it exercise? Is it meditation? Is it like what are, like how are people? It doesn't sound like they're getting cured from anything, by the way, either. That sounds like they're treating symptoms, right? And that's the other part that,
A lot of the traditional Western, the allopathic medicine methodology is built around, hey, symptomatic relief. Let's at least get to the point where where we can improve upon this, which is a bit of an irony in this situation because it takes so long to get them to the point where we can provide them relief with the tools that we have, which are primarily when you get that diagnosis, if you hung with it long enough, here's your script.
right.
It's the primary answer that they're going to get. We know that managing gut health has all kinds of benefits. Inflammation kills. It's just not a good thing. If a fibromyalgia patient is drinking too much, that's just a nightmare that has to stop before anything can begin. And by being able to see these things and make sure that we've got good information coming in, we'll spend 90 minutes and have a couple hundred questions, and they're tiered down. So it's not like they have to answer a couple questions, but that kind of detail we need to get to put the longitudinal zero party data, the direct from the patient information in that's pulled in from a clinician that knows how to manage this to get good information. It takes that. They don't get it with their 15-minute session every 4 months caught in the traditional paradigm. So changing that does two things. It allows us to really more efficiently deliver care by reducing friction. And it allows us to collect a great deal of data. And we're putting out, there's so much we can do now with remote patient monitoring and those options to get good information.
So what's the game plan? Like, how do you go through, I guess, a couple things. One is you're going to need some sort of patient acquisition process or system, right? And then you're going to need to recruit and get clinicians on board too, I'm guessing along the way as well. So what does that look like for you building this model out?
It can scale out. Let's address the first or the last thing you said first. Clinicians will manage a number of nurse practitioners and physician's assistants underneath them. We'll have a cadre of nurses underneath them, and we can roll it out in a cadence that allows us to scale to it. We've complicated our equation a little bit because we got some feedback. The patients that we're working with, at least in the start, and I would think this holds true with most complex chronic conditions, but they hurt. They haven't slept. They're not necessarily processing everything cognitively. They do not want to have to speak with resources that are abroad. So a lot of these calls for telehealth organizations are outsourced. We've built in having US-based clinicians. So it makes it a little more difficult, but the system that healthcare professionals are working within right now is truly a treadmill. It's really difficult for the clinicians to push the amount of work product that they have to through the system. I have a friend that's a surgeon. I've stayed at his home when he's come home on clinic day after we grabbed a piece of pizza and stayed up till 1 doing case notes. He's in the OR at 7. That's no way to live. And we're asking these people to
Or to give
provide
your
a
best the
care.
following day as well too, right? Like it's not just a living, but it's just, like your body does need to rest and it needs to recuperate. And, to give your best, you need to rest a little bit too and turn your mind and your body off.
Correct. And that's what happens with fibromyalgia patients. They can't rest. What a
Right.
vicious cycle. I mean, it's a big part of the challenge.
So this patient acquisition process that you actually did the interview of the 90 minutes. So that takes part of that hardship away from the clinician too, I'm guessing, along the way, like when you're acquiring those patients in the door. Is there a process around that, or does that still happen with the clinician, the intake?
Oh no, we have either a PA or an MA will handle that.
Good. Okay.
A nurse, actually, a nurses are qualified to handle that, but
Good.
initially, we'll have the nurse do the patient input, the follow-on appointment where we start to look at what care paths we want to start down. That's managed by a PA or an MA, or excuse me, a nurse practitioner, a PA, and then the physician oversees them.
Okay.
In most states, I mean, those, we need to involve the physicians have oversight on everything. And obviously our definition of success is a little bit different.
Okay.
We actually want to see how many of them we can roll out at the end of the equation. We'll keep them going through.
So you have a telehealth platform, that's a revenue stream, right? Along
Correct.
that line. And then I'm sure the data collection process has a lot of value to, a lot of other stakeholders in healthcare as well, right?
Right.
Not just, the data architecture itself, but pharma, research, all those things.
The financial institutions tracking these verticals want all that information. Hospitals want that information. Businesses, organizations that are self-insuring certainly want it. A lot of businesses are moving towards value-based care, where they'll actually come in and say, hey, take all our fibromyalgia patients, you manage them, and make sure you do it well enough to have a profit at the end of the day, and everybody's happy.
Right.
So, all those things are played. One thing you mentioned earlier is the patient acquisition process. A lot of that, we'll be pushing out this content that we create that will
Right.
be, our assets, and hopefully it gets legs because it's good. We benchmarked a lot of this. I would say we benchmarked at least half of the stuff in the space, a little bit beyond using courier type with no kerning as far as how advanced it was,
Right.
as far as being good, engaging, content. So we'll do that, but we do spend on media to send people into some of the studies that we're running. We have investigators who run studies and do this for a living that help us design experiments to make sure, hey, let's go figure out whether or not this works. So I mentioned at the beginning that head-on collision, having that challenge, getting into bioelectronics, and that really, came full circle with all this when we figured out there are a lot of things out there that work and that can add value and can be stacked on top of each other. Can't put Cymbalta on top of Lyrica, on top of
Right.
an off-label application of gabapentin and hope for the best.
Right.
However, I can see that there's some interesting things happening with red light therapy and its ability to increase ATP production. So without getting into the technical details, ATP is the little batteries that run your cells. Very important. It's
Okay.
part of that process. We need them when we're healing. We need them when we're trying to overcome challenges with our immune system and things like that. We need them if we've got issues with diabetic neuropathy that can reduce inflammation very quickly. It's keenly interesting. So we'll direct some people towards those studies, and getting them into those studies gives us the opportunity to tell people what we're doing. and why we're focused here. And then we're starting in 6 states. We'll roll out sequentially in a phased approach across those 6 states. We're headquartered in Indianapolis, and great environment to be in telehealth care from, and also a favorable tax rate. So that all
Right.
worked out. But that gives us the ability to really scale this. I mean, we can scale geographically. Sales numbers are hundreds of millions of dollars as far as the number of people we'll be employing 125 or 35 nurses in 4 or 5 years, and then scale up from there. So it's a pretty significant opportunity to scale, and we've got everything we need to do it efficiently. And having those 2 revenue streams certainly helps.
Absolutely. And, that's the business model part of it. But, going back to the friction you're removing is, an access to information for a patient that's really challenged with finding a solution, right?
Mhm.
A lot of pain, losing sleep, not feeling well, missing work, not being able to take care of families. There's a lot of friction in the patient's lives as well. Sounds like clinicians are continuously sort of guessing what treatments to and how to diagnose and what to do for what specific treatment. So another great place for clinicians to collaborate, by the way, as well, right? And then since you're going to be data foundation based, you'll be able to do a couple things with the data. Number one is measure what works and what doesn't work in certain situations, and having that large data architecture will allow you to do that. And then you're building, an asset with data that, and I'm sure that there are lots of institutions in America, whether they are on the drug side, the healthcare provider side, the insurance side, that all would find the information you're creating of value. So, like, what a great business model, clinically providing, data providing, and taking care of patients at the same time. Sounds like everybody's kind of a winner in the ecosystem.
God, from your lips to God's ears, Terry. But you're absolutely correct. I mean, we do have a secondary market for the information. Obviously, all of it is no patient ID information. It's all
Sure.
here from HIPAA, but the informatics we derive from it have almost, they have value also. So here's what we learn
Yep.
from this information can be really important. But we want to do a great job providing patient care, and we go at it from a little bit of a different perspective because uh, our emphasis is not necessarily where the healthcare system's emphasis is. And we all have deep understanding of systems thinking. I mean, this is a gaggle of engineers, software developers, and statisticians and analysts that work on this stuff at the behest of
Well,
the
you're
clinician.
building, yeah, yeah, you're creating access to healthcare that, again, just there's so many specialties in our healthcare environment today that, as you stated earlier, take months and months and months to get access to. And now they can go online and get on a platform and have engagement within 24 hours. So, that's a big relief, because just being able to talk to somebody is 90% of the psychology game versus having to wait 6 months and not find out anything while you're suffering with pain and sleeplessness. So, all those things kind of play into, well, speed to care, access to care. What a great story. And I feel privileged to meet you today. And we wish you and Rapha nothing but the best. And if there's anything that we can do from a zero friction or a RevRx AI perspective, we're here to help.
Terry, I appreciate it immensely. It was really good to have a conversation, and you drew out some interesting thoughts along the way. So absolutely, we'll be reconvening, and I appreciate the time.
Great. Thank you, John. Good luck to you. That's a wrap on Zero Friction, the show built around one simple idea: remove the barriers and the revenue will follow. If today's conversation was valuable, please subscribe and share it with somebody who needs to hear it. That's how we will grow this community. I'm Terry Kuchaluchis, revenue architect powered by AI. Come find me at my website, myrevrx.com, and let's talk about what friction is costing you and your organization. Until next time, keep removing the barriers and keep the revenue flowing.